Good morning and welcome, everyone. Thank you for being here with Amazing Kids, where we believe people with autism are truly amazing. Please mute your microphones, keep cameras off, and use the chat feature to share reflections or questions as we go. We will open live Q&A near the end of today's conversation, and you are also welcome to email questions to amazingkidsautism@gmail.com. Today's conversation is part of our Autism Playbook series, where we focus on giving families practical guidance and real-world insight into navigating the autism journey. Let's begin. I'm Simone Olson, co-founder of Amazing Kids. Amazing Kids is a virtual autism diagnostic clinic serving families across Florida. And we're actually coming to Virginia soon, too. We believe children deserve access to comprehensive, evidence-based autism evaluations in less than 72 hours. At Amazing Kids, we believe a diagnosis is not the endpoint, it is the beginning of a plan. Our mission is to empower parents with teamwork so children can grow towards independence and confidence. A critical part of that journey is understanding how different supports fit together over time, including behavioral health and family support. Today's conversation is about that piece of the journey. Today on Amazing Kids podcast, we are honored to welcome Wendy Kumara, a licensed clinical social worker with extensive experience in pediatric behavioral health, parent coaching, maternal mental health, and family support. Wendy brings a unique perspective that bridges both professional expertise and lived experience as a parent. Through her work, she supports families in understanding their child's needs, navigating emotional and behavioral challenges, and building sustainable systems of support over time. Her work reflects the reality that supporting a child with autism is not just about therapy sessions, it is about the entire family system and how that system grows, adapts, and strengthens. Good morning, Wendy, and thank you for coming today. How are you?
I'm wonderful. Thank you for having me.
Well, thanks again for participating. Wendy, as a military spouse and mother of three daughters, she brings professional expertise and lived experience. Her clinical background includes work as a behavioral therapist, parent coach, and child welfare caseworker. She focuses on supporting families through pregnancy, childbirth, and the transition into parenthood. She has particular insight into the challenges faced by military and highly mobile families, having navigated 10 relocations over the past 15 years. That is incredible, Wendy. Thank you for
Yeah,
you and your family's service.
thank you.
She earned her bachelor's degree from Marquette University and her Master of Social Work with a concentration in mental health and military social work from the University of Southern California. Wendy is known for her clear, direct approach, helping clients navigate life transition, manage uncertainty, and building sustainable support systems in changing environments. Thank you again for being here. Dr. Hensley, please get us started.
Good morning, everyone. I'm Dr. Jennifer Hensley, pediatric nurse practitioner and founder of Amazing Kids Autism, where we do virtual autism evaluations within 72 hours. And we provide this amazing autism playbook seminar series to continue to partner with families. If you are here this morning, it's because you deeply love your child. You're searching for answers, you're searching for support, direction, and maybe even just reassurance that you're doing enough. So autism care can feel very, very overwhelming. There are evaluations, there's therapies, there's IEP meetings, there's long wait lists. In the middle of all that, guess what? You're still trying to be a parent. You're trying to connect with your child. You're trying to manage your home. You're trying to sleep. You're trying to work and somehow hold it all together. So what we have learned here at Amazing Kids is that autism care is not just about therapy hours. It's really about daily life. It's about emotional health. And it's about regulation, resilience, and relationships, and it's about helping children to flourish, not just function. So that's really where behavioral health comes in, and it's absolutely essential. So it's not about changing who a child is, and we've talked about this previously. It's not about fixing a child. It's about supporting how a child experiences the world. It's about strengthening that emotional regulation, communication, coping skills, confidence, family connection. And it's about preventing that crisis instead of constantly reacting to the crisis. So here at Amazing Kids, our goal is simple. We walk with families. We believe autism care must be collaborative, integrated, and strengths-based. We like to empower parents with teamwork. So we do not separate physical health from mental health. We support the whole child and the whole family. We also believe that families should not be navigating a fragmented system. Too often, parents are left coordinating between pediatrics, therapy, school, behavioral health on their own. And our mission is to reduce all that fragmentation and to build a team around a child so that you are supported and not stretched thin. So, this is why I am very honored to introduce Wendy, my colleague in behavioral health. We partner intentionally because proactive behavioral health support changes outcomes. When we strengthen parents, when we support siblings, when we equip children with emotional tools, we create stability, confidence, and growth. So, autism is a journey that nobody should be walking alone. This morning is really about building partnerships, it's about empowerment, and most of all, it's about helping your child flourish and not alone. So, today we want to focus on behavioral health within the autism journey and how it supports not just the child, but the entire family over time. So, our goal is to give parents a clear understanding of what behavioral health support actually looks like in practice. And when it becomes an important part of their child's care plan, we see success. So, good morning, Wendy.
Good morning. Happy to be here.
Thank you so much for coming today. So, I would love to just start with your perspective and your path into this work. So, how did you come into pediatric behavioral health and family support?
Well, I would say I stumbled into it. After my undergrad, I was new military spouse and I was moving to Germany for the first time. And every job I was interested in was involved in MSW, and I didn't know what that was. I researched it. I thought, oh, this is anything I would ever want to do. So while I lived abroad the first time, I started studying for my MSW and then found my way to working with children because my USC said, what do you want to do? What's the goal for, what you'd like to work for? What population do you want to work with? And I said, oh, adult service members. And they said, okay, great. We're placing you with children. Because yeah, the idea was to take you out of your comfort zone because you don't know what you don't know, right? So I ended up working in an after school program and I was very nervous. Um, I didn't have any children at the time. I wasn't sure how to relate to them, but I found it incredibly satisfying and rewarding. So I continued to pursue working with children and families, not to broaden my practice, but also because working with children is a very important way to influence family systems. Those kids have a huge impact on what's going on in the household, how their parents are working. So I see pediatric behavioral health now as micro level practice that really contributes to breaking generational cycles and influencing a greater society. It's teaching skills young and early that will follow people through their whole lives.
Excellent. Excellent. What a broad way to look at it. That's fabulous.
Yeah,
And so being a military spouse, you have a lot of lived experience with moving and living in different countries. And as a
yeah.
parent, how has that shaped the way you approach your work and with families?
Well, I think as I've as my practice has grown and changed and as I've become a parent, I see the value of practicality, right? I know to you must give people things that can work and things that can work within their life. Like you can't I know the importance of providing the correct tool for the correct job because if you give the wrong tool, it's frustrating for everybody, it's self-defeating, you feel like it won't work. So really finding that practicality of what the treatment is. I also know that like seeing your kids struggle sucks. Like I know what that feels like as a parent to not be able to fix all your kids' problems. When they're babies, you can fix everything. You know exactly what the problem is. You can solve it as they get older and move into school age and then the teenage years. You don't have that anymore. So I get the feeling of feeling helpless and wanting to do a thing. And I really hope that I give parents the thing they can do to help the situation in their home. I also am a big proponent of understanding the why. So, having parents understand the neurobiology of behavior change and what the behavioral presentation of a diagnosis can look like so they can try to relate to what their kid's experiencing. Because if they aren't neurodivergent and their child is, it's a new experience to understand what that kid's perspective is because their brain just works different than yours. And I think it's really important to support the family system. So with pediatric behavioral health, the patient or the client is not just the child, it's the whole family because that kid can't do the work by themselves. The work's going to be done by the whole family between the sessions. So I just find offering education and support and empathy is the biggest thing I think that I've come away with as a parent and a provider.
And regarding the family, like how would you recommend a family look for a behavioral health provider that can support not only the child but the family? It seems like there's challenges to even get the child in for one-on-one therapy, much less, the parents and the
Yeah.
sibling.
That is tricky. It would depend provider to provider and what the practice is willing to let you do. Coming from hospital social work, it was easy for us, especially in the military community. We didn't need the specificity of different codes to charge for different sessions. So if you have the availability to have access to a system like that, that's great. Most people don't. So I think having conversations with your providers is very important about what they're able and willing to do. Some people are not able to do family therapy or aren't willing to. So if you can't come to therapy together, thinking about what other providers might be available for your other kids, because it's not just the child with the diagnosis that is experiencing the diagnosis. The whole family is having experiences with that, depending on what your child's going through. So I would really have open talks with the provider and say, like, my child is this age. I know a lot of parent coaching will be involved. Like, how do you envision this moving forward? Can we work with that? It can be hard to access. Providers are busy, and that's hard too. So kind of sometimes you need to be that squeaky wheel to get that attention.
Absolutely. Absolutely. Thank you. So let's kind of transition to behavioral health across just different developmental stages. So we can, again, our focus today is autism care as well. So if you can kind of pull in, I do feel like most families get so focused, especially if the child's been diagnosed very young, with that intervention of therapy, such as ABA therapy or speech or OT. And we really and truly neglect and forget, I think, that our behavioral health colleagues are there and a tremendous support. And so, can we kind of just walk through the different stages of child development as their needs evolved for children with autism? What does behavioral health support look like for toddlers and young children?
So for toddlers and young children, it's really going to be parent coaching. Toddlers and young children, they can engage with the therapist, they can have good rapport, and that's important for buy-in to make them excited to try the new things. But parents have to be very involved at that level to provide the structure around the behavior change. So if we're working on tantrums or we're working on communication, the therapist in the session is going to provide the skills, probably part of the session with the child alone, but then with the parent as well, and then expect them and explain to them how to practice in between sessions.
Excellent. And actually, one other thing I kind of want to take another little bit of a step back. Can you just explain to the audience the different members of the behavioral health team?
Yeah, sure. So if you have an interdisciplinary team working with your kid, you're probably going to have, you'll have social workers, counselors, psychologists, psychiatrists. Some of these terms are interchangeable. Someone might be called a therapist, and your therapist might have a different alphabet soup of credentials behind their name. But basically, a therapist, a counselor, I'm sorry, a therapist is going to be the person providing the clinical level behavioral health care to your child. A counselor could be a social worker, but may not be, and would provide either non-clinical level counseling, which would just be more support and coaching, or case management. Whereas a psychologist will do testing. So if you are testing for autism is one and different things that are going on, they may also provide therapy. Whereas the psychiatrist is able to do medication prescribing and therapy, they may provide testing. You're going to have the most talk therapy at your therapist level, at that social worker, clinical social worker level.
Excellent. So parents, when they're looking for more of that coaching, that's kind of the level that you would recommend.
Yeah, and there's non-medical counseling. Like if you can look at different levels of it depending on what kind of therapy you want. There's group therapy and individual therapy. You have to decide, well, it kind of comes down to three things. So it's going to be your comfort talking to other people, what's available in your area, and cost. Sometimes it can be cheaper to do group therapy than individual therapy, depending on what your insurance is able to provide or what you're willing to spend or able to spend. So yeah, there's different modalities.
Excellent. And so with the toddlers and the young children, the focus is mostly on the parents because oftentimes they're still nonverbal, right, at that
Yep.
point in time. How does that change as we transition now to school age and adolescence?
So that's a conversation and a change that happens with all children, not just kiddos with autism. You have to introduce more autonomy. So giving them more realistic consequences, explaining what natural consequences are, right? Like explaining, especially for those kiddos who are having trouble with their social cues, here's why this is important. Because a lot of the kiddos with autism have, pretty logical brains, right? So if you say, like, here's why I'm asking you to do this thing and explaining it a lot, offering them more information to get the buy-in, I think is a big deal, and then letting them try it more. So putting more accountability onto them while the parents are still heavily involved monitoring the structure, but giving the kids more chances to practice. And hand in hand, I think that goes with education and explaining the society we live in, right? Because if they're not picking up those social cues naturally, how can we explicitly teach them and explain them in a way that makes them care about it? Because I think the buy-in is huge, right? And I think counseling can be a big part of that, where we help kids understand why we're asking them to do a thing and how it benefits them to make the behavior change move in a direction that benefits the child and the family. Because if the child doesn't see the inherent value in it, it's very hard to get a brain to decide to do behavior change, because behavior change is hard. And unless the incentive is very good, the brain's going to slip back into previous patterns.
Excellent. And so how does your approach differ for children who are verbal versus nonverbal?
Well, the important thing is with verbal versus nonverbal is less the speaking, it's the communicating. So how is this child communicating? If the child is not able to communicate, they're not going to be able to participate in talk therapy. If they communicate in a different way, helping the parent, I would ask the parent to help me understand how the child communicates and how we can do that moving forward, because it's a two-way street. Therapy for behavioral health, especially with kiddos on the spectrum, isn't one way. It's never me telling you to do a thing. I need you to understand, talk to me about it. Does this work? Does this not work? What works for you? So if that's signing, if that's something else, just having that conversation with that parent to decide what the way is to share, give, and receive information.
Excellent. And so I know you touched a little bit on individual therapy compared to group-based therapy, but how should families really think about that? And do most kids benefit with autism more from individual or more from group-based support?
It depends on what you're teaching, right? It depends on what you're trying to learn. So if they're dealing with anxiety or different issues like that that are clinical and they're younger, probably individual therapy is where you need to be. Now, if they're older and they've been through some individual therapy, their communication skills are strong, they're comfortable being around other kids. And by comfortable, I don't mean like enjoys it, has a great time, but is able to tolerate being in a room with other kiddos. Maybe group is a better idea. So if you're working on task-based things like you speak, then I speak. Like, I don't want to call it social skills exactly. It's just more the mechanics of communication. I think sometimes the group stuff can be good, or if they're looking for shared experiences or peers to relate to, group can be great. If there's a private thing or a clinical level or a safety issue, it definitely needs to be an individual session.
And what kind of group therapies would you recommend for someone with autism?
Again, communication skills groups. And I call it that. Social skills is loose, right? And I think for social, what I think the goal should be for kids with autism is social success. What are their personal goals and how can we get them to attain those? Do you have the tools, the building blocks that you need to get to achieve the goals that you want to have? If you want to be working in a specific field, how do you communicate in that field? What are the social skills you need to interact with those things? Therapy, again, a group can be good. It's a chance for those kids to practice, but that's an hour or two a week, and that's not enough for behavioral change. So if you're hoping by enrolling your kid into a social skills group that it's going to be the thing that changes the way that they interact with the world, it's not going to be that. But again, with a good provider who ropes you in to say, hey, we talked about this today, here's how you can practice it at home, that's where the key changes are going to be. So the group therapy can be a great way to introduce it, to practice it, to talk about what's working and what's not, and to make connections with peers. But again, it's not going to be the thing that is going to forever change the way your child communicates. It's just the starting point for the lesson.
Excellent. Excellent. So many families, I think, are still really trying to understand really how behavioral health still fits into the broader picture of
Mhm.
their child's care. I think we touched on this a little bit already, but the role that the social worker plays within a child's overall therapy team? What would you say is the role?
I think I'm biased, right, as a social worker, but I think what we're specifically trained to do is look beyond just the behavioral health of it and look into the system where the kid's operating. So what's what's working well at school, what's not working, where are the hiccups, where's the kid getting stuck, and then focusing on those things. And that's almost how I triage a session is, yes, we have these greater things to work on, but if you're having a problem with the peer, let's break that down and let's get to the nuts and bolts of what's going on so we can talk about specifically what you can do and move forward with it. And definitely, I mean, it depends on the age of the kid, but discipline and parenting, that stuff too, is like kid tailored to the child. And I think that's really important that the social worker sees. I don't want to go too far off on a tangent, but you think when you have a husband and a wife or a parent, whatever, two parents, there's one relationship, right, between the two of them. You add a child, and now you have three relationships, the parents' relationship, and then each parent's relationship with that child. Then you add another child, and all of a sudden you have six relationships because you've got parents together, children together, and then each parent with each child. So I think with social workers, especially looking at that system, seeing what's working, what's not, where the hiccups are, and being very curious, I think that's an important part of having a social worker on your team.
Absolutely. I love that. I love that. And what is the best way really for parents to get connected with a social worker? I know there's different areas that you guys work in.
Yeah, so that's the tricky part about social work as well, because you're going to encounter social workers in very different fields. If you're looking for a behavioral health provider that is a social worker, you're going to want to look for a C in their title. So I'm a licensed clinical social worker. There are licensed social workers that are licensed to practice social work, but they're not meant to be doing it in a clinical capacity. So there's a variation, LIS, CSL, there's again, the alphabet soup, but look for that C if you want a clinical provider for behavioral health. Otherwise, the social workers have jobs. They might be doing case management or casework, child protection, maybe school counseling, all different things like that. So it's a very, very broad field, which is what I like about it. But if as you're a parent looking for a provider, if you want someone clinical, you need to find somebody with a C in their letters.
Thank you for keeping that simple for our patients. That's great. I love
I
that. We
hope
can
it
do
was.
that. We can look for the C. We can look
Look
for
for
the
the
C.
C.
So, how do the behavioral health team, how does everybody really work together? Social work, counselors, psychologists, psychiatrists. How does everybody work together to support a child? Can you kind of give a bird's eye view of the collaboration that exists?
Yeah, I mean, in a perfect world, they'd be all a part of the same organization. They can sit down and have a meeting every so often about what the kids' needs are. You can be at that meeting and talk about how the different pieces of the puzzle fit together. In real world practice, that does not always happen, right? Like your psychiatrist might be in one practice, your diagnosis came from another practice, and your clinical work is done somewhere else. Then you've got to factor in the school. My best advice is to know where your information is held. So if you have the diagnosis, getting that on paper, having copies at home, or knowing how you can access it online. Because when you come to a new provider, they will do the intake and they're going to have to recreate the wheel unless you're providing parts of the wheel for them, essentially. So there's two ways to do that. You can bring your paper copies to a new provider and provide them with those that they can read themselves. Or if your provider is willing to, you can sign releases of information at the new practice and the previous one, or the psychiatrist's office and the social worker's office, and have both of them give them explicit permission to communicate with each other. And that can be very helpful because they can't do that because of privacy without your express permission. And you need to have a release of information on both ends.
Excellent. Thank you for sharing that. It is a perfect world, and Wendy and I were fortunate enough to have that perfect world where we did do a lot of collaboration with our different disciplines, which was just fabulous to be able to give those patients that high level of care and support with the team-based approach. But it is hard to find for sure for families.
It's hard to find and it's expensive. I always made a point with my patients too. I would ask them if they had a point of contact at the school right out of the gate, sign releases for me to talk to them. You can put it on for a year or not. But if something comes up and you want me to be able to have talks with the teacher or the social worker there, just get a release of information on file. And that way, if things come up, we can have more natural communication, more regular communication.
Excellent. Thank you for that piece of advice for our families. So, when should families really consider bringing behavioral health into their child's care plan?
Clinical behavioral health For me, it's when an issue raises to the level that it's impacting the child's functioning. So think of it this way. You can be anxious, you can be nervous, you can have a nervous kid, and that's their temperament. That's fine. They just are like that. That's their personality. Okay. Now, if it's getting to the point where they're so anxious they can't get on the school bus, this is a problem because now it's impacting their functioning and their education. So I think anytime you have a situation where you're not getting done what you need to get done, it's time to think about bringing in a professional who can help you. So whether it's discipline, your kids' tantrums, I mean, I've had families that they can't go out to eat because the kids' tantrums are so bad in public and they feel like they're, kind of home all the time because they can't trust their kid to behave in public. That's impacting their functioning. That's not the goals they want for their family. So how do we do interventions to help this family do what they want to do? Not all families want to go out to dinner. That's okay too. But this family did. So how do we treat that to get them where they want to go? And I think as soon as you hit a roadblock where you can't accomplish what you want or need to do, it's a good idea to get some extra help.
Excellent. Excellent. So, parent coaching, right? So, parent support is such a critical part of this process, which is
Mhm.
again why we're really doing this Autism Playbook seminar series. What role does parent coaching play in improving outcomes for children related to behavioral health?
Yeah. So parenting, a dynamic of it is biological, right? You have a child, you've got the urges, the whatever instincts to take care of them. Parenting also is a skill. So your kid doesn't come with instructions. It's not like child A, I have to do X, Y, and Z. Child B, X, Y, and Z won't work. I've been told I do A, B, C. That doesn't, no one tells you that, right? You don't know what kind of child you're going to get, and you don't know what kind of parent you're going to be until you're in it, right? So you have your instincts, but you only know what you know, right? So how you were parented will play in how you see in the world what will happen. But sometimes it benefits to talk with somebody who has read a lot of the books, who has done a lot of the training, who has done the work to know what is usually successful. And I mean, nothing I ever say in parent coaching can be effective for every family because you don't know what kind of kid you're going to have. And it's just something that's very fluid. But I think parent coaching can teach you consistent tools, at least the way I teach it, where you are going to have a framework for trying things and seeing what works and what doesn't, and having a plan in place. So when behaviors do come up or big issues do come up, you aren't feeling like you're floundering. And I think that can be really important because the more educated and engaged and consistent a parent can be, I think the better the child can be taught, the better regulated the child is, and the more you can practice positive discipline, you can really be proactive in your parenting instead of reactive. And that can help create a nice, more calm home environment.
And I'm sure just build a lot of confidence for the parent as well,
Right? Because you don't know what you don't know.
right? Yeah. Yeah. Do you typically address like the appropriate developmental age of the child during that process? Because I think sometimes too, with parents with children with autism, they don't really realize they should be doing a lot of typical behaviors that other kids do. And so they don't even really know how to interact with the child. Can you expand a
Yeah.
little more on that?
Yes, I can. I think it's very important to meet each child where they are. So you can tell me a typical child is like this at this age. Great. Who is the kid in front of me, right? Like, what is this kid doing? What are they capable of? Just because they have an autism diagnosis does not mean that they're not capable of reaching other milestones or completing the goals that you have in mind for your kid. Or perhaps you've written a goal or a milestone off, and that could oftentimes have been premature, right? So when we're doing parent coaching, I like to know the parents first. I like to have a call with them, even if it's a group parent coaching session. I want to start with education and discussion. Tell me what's working for your family. What are your strengths? Because every family, even the most chaotic, has strengths, right? And those are things they can build on and feel confident about. Then tell me what techniques are going on in your home. Like, how is it working? Is this working for you? Because oftentimes in therapy, I'll be like, how did that go? And they'll be like, not great. They're like, yeah, do you want to try something else? And they're like, yeah, okay. So that's the way to start. But it's just coaching is teaching the techniques that the parents are going to be responsible for practicing at home. And I think talking with the parents about self-care and communication and self-regulation strategies to model for their kids. Because ultimately the children, the parent is their teacher. The parent is their number one teacher. As important as other professionals in their lives roles can be, the parent is primary in forming who that child will become.
Excellent. So, what does effective parent coaching actually look like in practice? So, you have this parent in front of you.
Mhm.
You have the child in the room with you. What does that look like?
Yeah, I think with or without the child in the room sometimes, but I think the important thing for no matter how old the child is teaching the parent how to enforce natural and logical consequences. So a lot of times I think when we have kids with special needs, we shy away from those natural consequences where it's a natural consequence is something where if you don't do any intervention, this is the thing that will happen. So if your kid forgets their mittens, you don't remind them, they go outside, their hands are cold. It's letting their hands get cold so they feel the importance of why you're asking them to do the mittens, right? So I think talking with parents about tolerating their children's discomfort when they're holding boundaries. Logical consequences are things that you put in place in the home. So, I told you you can only ride your bike in this perimeter. You rode it out, so now you've lost privilege. You have lost the privilege of the bike. And I think a lot of the parent coaching starts with those boundaries and boundary settings. So we explain and communicate what the expectation is and what the consequence will be if that expectation isn't met. And that's how you're going to impact the neurobiology of the kids and get to behavior change. A lot of that, though, also comes with teaching self-regulation, frustration tolerance, and communication skills, because all of those things are going to go hand in hand. You can do all the parenting techniques you want in the world, but if you aren't able to regulate when you're frustrated, and you blow up at your kid, it's out the window. And of course, everyone blows up at their kid. Part of it is teaching the repair after the rupture, because we are all human and not perfect.
Yeah. So, how can parents really better support their child while also managing their own mental health and well-being?
They need to pay attention. If you're feeling burned out, if you're feeling frustrated, I think just like emotional regulation is a learned skill and it is a practice. So, just like you learn to read or ride a bike, you are introduced to the building blocks of it, you practice it, you become more adept at it. A lot of adults in our society were not taught how to regulate their emotions and their feelings. So they have a big feeling and they have it, and then they don't know what to do with it. So do you shut down? Do you yell? Do you retreat? What is that coping mechanism that you do? Because would I would guess that that's probably what your kid's doing too. So doing some introspection about how you're able to regulate and then practicing those things. And it's very hard. And the goal is never perfection, it's only progress. Progress, not perfection, all the time for therapy is just moving in the direction you want to go. But parents have to put that mirror back on themselves because there's no change that's not going to come from them.
So, let's transition to real world challenges and misconceptions. So, families often face a lot of challenges and delays when trying to get access to the right support. So, what are the most common misconceptions families may have about behavioral health that you've encountered?
Yeah, I think help seeking in some ways can be seen when you're going to find a therapist that there's a failure or a deficit in some way. And that is just absolutely not the case. What therapy does is opens a door to address something that's not working for you. So if you're thinking of like a medical comparison, right, when you're coming to look for therapy, if you have warts all over your hands, is it going to change the way you live? Maybe. Are people going to notice? Probably. If you do nothing about it, is your overall health impacted? Probably not. Now, if you have an open wound and it's bleeding everywhere, you need acute care, right? So sometimes you have an issue that needs help right away. Other times it's things that can sit and wait. Behavioral health is a spectrum. There are things that are more like warts and more things that are like bleeding open wounds. So depending on what you're needing care for, just knowing that engaging with services isn't a failure, it is a connection. It is essentially finding a coach to teach your kid the tools that you need. And think of it in a way almost like if your kid really wants to play soccer and you don't know how to teach soccer, you would get a soccer coach, right? You'd put them on a team. That's very much what therapy is. If your kid is acting out in class and isn't able to sit through class and you don't know how to help them, then roping in a behavioral health professional may be the best move. I think A big misconception with therapy is that therapy will fix your kid. I've had parents like, this isn't working. And you're like, well, yeah, but what are you doing in between times? A therapist alone cannot create the behavior change in your child, and that can be really frustrating. But doing the work at home helps lead to the changes. Did I answer that?
You did. No, that was great.
Great.
And I think you might have even answered a little bit the next one. What mistakes or delays do you see often when families are trying to access the support?
The
Maybe
one
it's just
the most
delayed access.
delayed access, well, becoming frustrated, yeah, with those wait times. But think
Mhm.
about it, is it a wart or a bleeding wound, right? Warts can wait.
Right.
It will still
Yep.
benefit you when you get in with them. I know the wait time is frustrating, but most of the behavioral health problems will keep unless it's acute, right? Violence, safety issues, those need attention right away. And communicate those too. So you need to make sure you are explaining the severity. Don't downplay your kids' behaviors to their therapist. They're not there. They don't know. So if you have to explain it as much as you want to sugarcoat or protect, with the therapist, there's confidentiality. They're not going to tell anybody anything, and they can't help if they don't know how to solve the problem, right? Like you don't want them to be treating the wart when there's a bleeding wound, right? And they're just not aware of it. So
Right.
you need to have that communication. But the biggest reason I think I see people quitting therapy is that they don't mesh well with the therapist, which is understandable. Like if all the shoes in the world weren't meant for you, right? There's some shoes that were meant for you, and those are the ones you should seek out. All the therapists in the world aren't the right fit for your family. If you are getting vibes like this is not working, instead of quitting, either having a conversation about it or actively finding another provider, I think is really important. With the caveat that therapy is going to be difficult because behavior change is difficult. So I'm not talking about not being able to tolerate frustration during the process. I'm talking about a personality clash or a methodology clash that you don't feel comfortable with. If it's one of those concrete issues, then I think look for another provider. But if you're just uncomfortable with your kid being frustrated or challenged, that's therapy. That's the process. So you gotta have to just tolerate your own discomfort there.
And I've heard you a lot talk about the behaviors and focusing on the behaviors. Maybe the diagnosis is less irrelevant to you because you're focusing on the behaviors. Of course, with autism, every child with autism is completely different. Can you talk about either some behaviors or some diagnosis that you would see that would bring somebody with autism, into your office?
Yeah, and Jennifer, that's exactly right. For me, a child can have any diagnosis in the DSM, but I want to know what their functioning level is and what they're having issues with, and that's where I'm going to drill down and help. So a lot of times autism will come with comorbid diagnoses like anxiety or depression or ADHD, a lot of ADHD, and just seeing where the function issues are, right? Are you not being able to turn in your homework? Knowing with a brain that is autistic how to provide the therapy for that other issue too. Because the autism might be the wart and the anxiety might be the bleeding wound, right? So it's never one thing that I'm looking at. I want to look at the holistic kid and see what is it that is impairing their functioning today. Are they not meeting grade level because they are refusing to do their work? Well, that's a different thing, right? So autism is one part of what brings the it's rarely that a child is just seeing me because they have an autism diagnosis. It's usually something else is impairing their functioning in a way that is keeping them from what they want to be doing.
And how can families begin to build sustainable systems, especially during times of like transition or uncertainty?
Yeah, so that goes back to the continuity of care I was talking about earlier. Know how to access your records, be informed. Request if you're leaving a provider, can you have a copy of those records? Keeping the before you leave a provider, signing a release of information or getting their copy, a blank copy of their release of information. So when you get to your new provider, you can fill their information in and send it back to your previous provider. Something to keep in mind when you are going between providers, though, is that depending on the age of your kid will be how much access you're able to have to their behavioral health records. Because once they hit a certain age, usually in their early teens, depending on state, is going to be when they start to have more rights for privacy. So you probably aren't going to be able to get the full clinical record from that provider for your teenagers or older kids.
Thank you for sharing that. I think that's an important, and I think that's something that puts a little bit of fear into parents too about
Mhm.
accessing behavioral health care because there's limitations on them being involved in that therapy when their child is at that age. So maybe
Right.
that just circles back around to really finding a provider that you trust for your child, that you feel is going to be able to provide that support. You're not going to have to hopefully micromanage that intervention.
And that's, I mean, that comes back to something parents, all parents, not just parents of kids with diagnoses, is figuring out that timeline of pulling back and letting go and trusting a little bit. And that's hard for everybody, but especially hard for kids that need special care. So I think having those conversations and hopefully building rapport with your kiddo to be able to say, hey, we're going to a new doctor. I'd like for you even to fill out the release of information saying it's okay for them to talk to each other. Like, I don't need to know, but can they talk to each other? And having those conversations with your kids. Because sometimes that's like, absolutely, teenagers don't want their parents to know everything they talk about in therapy, but can the therapists talk to each other? And that might be a more palatable option for the kids.
Excellent, excellent. So to close, I really would love to leave families with just clear guidance and encouragement. Actually, every seminar that we've done, we always have a parent that says, I got the diagnosis and I was told my child would never be independent someday, or I got the diagnosis and I'm so devastated I can't like really move forward. Can you provide, especially with my first example, it hurts my
Yeah.
heart to hear that. I know it hurts your heart. Can you
Yeah.
provide some clear guidance and encouragement for families as they're getting that diagnosis, especially if a healthcare provider is giving them such a negative connotation with the diagnosis, which again, I will never give, amazing kids will never give, but I hear it unfortunately over and over and over again.
Show me that crystal ball. Tell me
I
how you
know.
can peer into the future and see what that kid can do. You don't know. We don't know. No child is born with everything mapped out. What you can do as a parent is put the structures in place to help them to be successful as they can be, right? And that's different for every child, but behavioral health needs are going to change over a lifetime. Therapy's in place and it's intended to teach and support so you can practice the skills. If you master a skill, you don't need to come back to therapy, right? Like, it's for that skill, for that issue, right? If you had social anxiety and now you're able to interact in school and you're doing great, please be in school. I don't want you to come to my office to talk about your social issues when you have mastered that problem. So behavioral health issues can be chronic or acute. It's like the the warts or the bleeding wound, right? Both can heal over time and you might get a new cut, right? So then maybe you come back to therapy again. But I would like families to think about behavioral health as when you get stuck, when you're not getting where you want to go, come engage with it. There are very few people in this world who need to be in therapy all the time, forever in their whole lives. This has nothing to do with their medications. This has to do with the skill building and what their functioning level is. And I think once you get a diagnosis, in my opinion, that's the beginning. And that is the door, that is the thing that is going to unlock resources. Being educated and understanding what your kid's neurobiology, how is their functioning, what are they capable of, and being able to advocate for them is huge. And I think that that can be really empowering for parents to feel like they can do something. Because as a parent, you want to help your kid, you want them to be successful, you want them to have everything. And when a roadblock comes up that changes the path that you saw for them, there's going to be grief there. And it's okay to acknowledge that that is not what you thought it would be. Doesn't mean you're sad about who your kid is. It just means you have to acknowledge your change. And that's totally normal. Every single change in life comes with grief and celebration. So being able to process that yourself or with your partner, or if you have a provider, working through that, because it's a very real part of the human experience to have a big reaction to life not going the way that you necessarily thought it would. So when you get that autism diagnosis, I encourage you feel all the feels. Acknowledge what's good, think about what's hard, talk about what you're concerned about, talk about what you might be excited about. And build that community if you can. The autism community, the autism support community is very strong. And I think that is a huge resource for families who are supporting kids with autism, is that they have other parents who are experiencing things the same way and being very open about, hey, this works, this didn't work, what works for you? And sometimes you can do that in a group therapy session. Sometimes it can be much more casual. So again, the needs are going to change over time. Come to therapy when you need the therapy, when your family needs the therapy. Be okay to sustain the change once you've achieved it, and let that diagnosis be the key that unlocks all of the resources for you.
Thank you for bringing up the community because the autism community is a very, very strong, probably stronger than any other diagnosis community out there. And it's so important for families to connect with one another and integrate, and kids to connect with other kids with autism. So thank you for bringing that up because they are key players on the child's team.
Oh my gosh, when I ran the social skills group, my favorite moment, I never asked them to share their diagnoses. And I would just say, like, introduce yourself. And then somehow it would come up that one kid's like, yeah, well, I have autism. And other kids like, me too. And then they would get chatting about what's different for them. And it was nice to see them feel like it was the norm to have
Yeah.
whatever it is that they're dealing with, and have a peer that could relate to what it's like to have their classes that they have and the challenges they have.
It's their superpower. It's their superpower. We're going to actually be showcasing a young man named Anthony who we met at the Tarpon Springs Brighter Days Autism Run. And man, is he fast.
Yeah.
He got first place. He's just absolutely amazing. And he found this skill set and he is just going. I don't know where he's going to be. He might be in the Olympics someday, but we're excited. We're going to be showcasing him and his superpower and his confidence with his autism diagnosis. So thanks for sharing that as well. So what should families understand about the long-term role? I know you already said like not very few people need to be in counseling long term, but what is the role and when should they continue to seek out services as their child is growing and developing?
As new issues come up. So, maybe they're going into grade school and need some help with self-regulation in class. So maybe that's what it focuses on then. Now middle school's hitting and the social stuff is coming into play. Maybe they need to see a counselor again to talk about that. They want to start talking about planning more independent living. What can that look like? So whenever you're at a crossroads where the goal you want to achieve or the need that needs to be met is impeded somehow, that's the time to come in for behavioral health. A lot of times you're going to have 12 sessions of behavioral health, and that should be enough to deal with whatever issue is going on generally. Some will need more or less. And it really just depends on how that child learns, how the family is able to practice and sustain the change. So it is hard to say exactly what it would look like for everybody, but just for me, the bottom line is anytime you can't do what you want or need to do, and it's because of a mental health or behavioral thing, that's the time to seek out behavioral health care.
Excellent. Thank you.
Yeah,
Wendy, you're so insightful. And so I just love your calm and genuine demeanor. It's so wonderful having you
thank
on
you.
today.
I
Like,
apologize if you heard my kids yelling in the yard.
you didn't, but we love that. We love
Okay.
that. That's what we're all about here,
Yeah.
kids. So I'd like to open the discussion. If anybody has any questions, you can either put it in the chat or turn on your cameras and ask Wendy any questions you may have.
Yes, I'm happy to answer.
So I can start. I have a question. It's sort of brewing in my head. I'm not exactly sure how to articulate it, but I'm going to try. So you were
Okay.
mentioning about, when kids are having therapy sessions or going through behavioral health sessions, the privacy issues as they become teenagers or starting to become teenagers. How do parents navigate if they think that there's sort of a problem, not a problem, but maybe the child isn't really connecting with the therapist, but you're not allowed to access the information. Your child's not really communicating with you. Do you have any recommendations for like parents when they're trying to navigate that sort of scenario, which I think probably happens with kids of, all teenagers?
Yeah, that is not common, not unique to kids with autism. It is okay to say at the beginning or an end of a session to talk to your therapist about how therapy is going without asking for the details of the session. Do you feel like you're connecting? Do you feel like you're making progress? Is this effective? Is this working? Is there anything I can be doing at home? It helps to have the kid involved with that. I always tell the kids, like, hey, I'm going to give your parents an overview because depending on their age, what you need help with at home. I would love for you to be a part of that conversation. If there's anything I'm very clear. If there's something you definitely don't want me to share, tell me that. And I obviously am experienced enough to know when it's a sensitive issue, but I think it's always okay in my book for a parent to ask how it's going. I know very clearly when sessions are not effective, and I'm happy to tell that to a parent. And sometimes it's rapport building. Sometimes the kid's not ready for therapy. Sometimes the kids, we need to bring the family in because that's the level that they're at. So it'll be a bit of a learning process, but if you have concerns, I would definitely tell your kid too, like at the end of the session, I'm going to ask how it went. I'm not going to ask for what you talked about, but tell me how it's going and keeping a pulse on that.
Great, thank you.
Yeah.
I think there's a question in the chat, actually. Let's see. How do you empower not only the parents, but the kids themselves to implement the tools learned in therapy into daily life? What are the ways to help encourage the kids to practice the tools, especially younger kids who may not understand the why behind some of the techniques?
Yeah, that's an awesome question. So I like to use
Savannah
real world examples.
question,
Oh,
another good one.
yeah. Okay. So the parents and the kids, I need the buy-in, right? So one of my favorite tools is to for all kids, not just kids with autism, is to make the internal external. So how can I have a concrete way to show you what I'm hoping you do and what's the incentive when you do the thing I do? So what is in the moment incentives that can add up over time to show them that their progress leads to meeting their goals? I do this thing called a paperclip chart where you have like every time you do a thing that's I'm asking you to do, we move it the right way. If you don't do it, you move it back. And then once all the paper clips are on one side, you get to color a star and you do that 7 times. So my kiddos are on it here at home and I work, one of them's working to go to an indoor pool. Another one just wanted to go indoor rock climbing. One time, one of them wanted to, I mean, it doesn't matter what it is. When they were really little, they would want a toy and I would buy that toy and put it on top of the refrigerator and say, every time you use, your manners or you pick up this thing or whatever it is that I was asking them to do, we can move a paper clip. So I want to give you all the paper clips. I want you to get to your goal as fast as possible. It's up to you when you get there. So having the kid buy into if their thing is ordering for themselves at a restaurant, every time they do that, they get to move a paper clip. If they don't, when they get home, they move one back. And you're like, oh, that's the pits. I wish you were closer to your goal, but it looks like we're going to have to keep trying. So just having concrete tools in a way that has the kids be able to visualize what they're working towards and why it matters to them. It's the same thing dealing with like the discipline techniques, I guess. So if you're wanting to create change in your kid, if you're like, they do something and break one of the boundaries you put in place, and you're like, well, no ice cream for you, but that kid doesn't like ice cream. They're like, all right, I'm going to keep doing the thing I want to do. You have to find out what's important. Does your kid love monster trucks? Then guess what? They just lost access to that specific monster truck that they love. It's living on top of the fridge now. So knowing what the child is invested in and motivated by, and using that to show them that I'm happy to give it to you. I'm happy to provide it to you. It's your behavior that's going to get you there and helping them keep track of that. I also love making it a game for the kids, like especially those social skills. One of my favorites is read the room. So pause a TV show right before you know the climax is coming. How do you know this character feels that way? How do you know this person feels that way? Look around you. I do that in restaurants too, or like in public. I'll do a pause and it's look around what's happening right now. What volume are the people talking at? What are their faces doing? What are their bodies doing? And that's generally a good cue for kids that don't pick up on it to look and then mirror. So just trying to teach those real interactive things that can be interesting and engaging, but also effective.
I love that. Wendy, we want to be in your house with your kids. We want to be a part of the team.
I'll bring them in. You can tell them. They are less thrilled when they have to move their paper clips the other way.
So do we have any other
There
questions?
is a question, another one. Can you share some major breakthroughs that you have had, especially as it relates to more acute behaviors or barriers that it seemed impossible to overcome?
Yeah, I mean, I've worked with some very, very challenging kiddos. A lot of it centers around aggression. So take kids, one of my favorite examples, actually, it's the same family I was talking about earlier, where they weren't able to go out to restaurants. The kids would tantrum and fight so bad. They had two sons, one was 4 and one was 2. The 2-year-old was not neurodivergent, the 4-year-old was, and achieved a diagnosis while we were working together. The parents were initially very hesitant to engage in therapy. They did not want to try medications. They didn't want to, they're like, my kid's 4. And I got that. As a parent, a 4-year-old, the idea of any sort of interventions is so challenging. So what I was able to do is work with the family and think, what's typical behavior for a 4-year-old? What's being a little boy and what is manipulating the situation? So we could drill down that he knew when he acted out at school, if he lashed out and tried to hit a teacher, they'd call mom, and guess what mom had to do? Come pick him up and bring him home. And then mom still had to work from home. So she would be like, just watch TV. I will deal with you later, which is a valid thing. Like if you pick up your kid from school, your day doesn't stop if you're a working parent, right? So we were able to work through teaching both natural and logical consequences and putting him in an incentive system to be able to make choices for his behaviors. So a, a big thing that he was able to do, even at 4, was like, hey, when you have a big feeling, let's take a beat and think of all the choices you have for how to react to this. Can you hit your teacher? Sure. If you hit, but then what's the consequence of that? And like even at 4, mapping out with the family what that looks like. And then he was able to start to make his own choices. Now, that did happen. He also had an ADHD diagnosis, so he was put on medication for that. And those things all happened at the same time. But by the end of working with this family, they were going on outings together. They were joking together. They were enjoying each other because the parents felt like they were just constantly correcting, and the kid just felt constantly critiqued. So by focusing on what was going well, feeling like I was giving the kids some power to have an impact over what was happening, that was a big deal for me and them, I think.
Thanks, Wendy, for bringing up medication as well, which we really haven't addressed much on this show. I always like to tell families when they have children with autism, if we have autism and we have ADHD and we have anxiety, if I can
Mm-hmm.
treat the anxiety, whether that's with therapy and medicine or just therapy or just whatever the combination is that's going to work for that child, if I can bring down that wall and that child's not anxious anymore, we can
Right.
just get to the autism, right? Because the anxiety's gone and that therapy becomes so much more productive.
Mm-hmm.
So if we treat the ADHD, even though it's terrifying as a parent to put your 4-year-old on ADHD medicine, it is game changing. These kids
Well,
go from hyperactive and unsafe to sitting and learning and showing the world what they're capable of doing. So it absolutely unlocks their potential, and the therapies again become so much more productive. So I appreciate you bringing that up because it's critical. If we can bring down every wall that we can for these kids, they're going to function at the top of their ability, and they're just going to set the world on fire, which is what we want for them.
and that's the real important part of getting good assessments done is what is the block here? And good medication management shouldn't change your child's personality. It should just essentially let them get out of their own way. So whatever neurological pattern is happening that is not letting them get where they want to go, the medication can just correct that, bring it back level so that they can move forward with what they need to do. I get that. I have a child with ADHD and we struggled with medication, with interventions, and finally I myself thought medication would be the first line treatment because as a professional, I know that, but I respected my husband's concerns not to put our kid on medicine right away that she might need to take for a long time. So we had talks with her teacher, her care team, and ultimately after a while we decided to do it. And it's just, she's the best version of herself, which is really nice to see.
Yeah. Wonderful. And oftentimes what we see is if kids are not treated with medication as they get into school, these people with ADHD are super smart. ADHD is like you got a race car brain without good brakes. Best
Mm-hmm.
race car on the track, best paint job, best tires, best engine. But if I don't have good brakes, I can't slow down and start and finish the things that I need to do to be successful. So I can crash, I can run out of gas, I can just keep going around and around that track. And so once we give these kids breaks, they function at the top of their ability. If we don't give them breaks, they get into school and they go from general ed to special ed because they need support because they can't behave, they can't focus, they can't show the world what they're capable of. Instead of more than likely, that child really should be in advanced education. Their
Mm-hmm.
behavior limits them so much and they end up in special education. And so when you layer autism on top of that, I have a child with social struggles repetitive behaviors and they can't focus. And it's like, oh, they have autism. We'll just put them in special education. And that's not necessarily where they should be. We treat the ADHD, we calm them down, and then all of a sudden, that child with autism is advanced education, just like that typical child could be because they're intellectually capable of handling it. So it's definitely something, again, hopefully not long term, but that medicine can be life changing. So I know that was probably a hard journey for you and your family, but it's
But
good to see those results.
absolutely. And what it can do too, medication can let your child have the headspace to learn the skills. So it doesn't need to be forever. Oh, well, you never know. It depends on what's going on with the kid, right? But if you do a lot of skill building and you're seeing a lot of change, maybe try without and see if the kid's able to sustain it without it once they've learned how to do it, once their brain has changed into those new patterns. Because your brain is changing all of the time. Your neuroplasticity doesn't stop as you're aging. You're always able to learn new behaviors and try new things. So it's important to, have those conversations and have it be ongoing because bodies are not static.
One other question that I want to add here, and I know we're a little bit over time. When do you really feel it's important for a child to have cognitive testing with autism? I mean, I typically am going to say around that 5 to 7 year old age, if there's true concern for intellectual disability, or the opposite, feeling like your child may have a very high IQ. What is your experience? I know every child with autism is very different. What's your experience, and when would you recommend that a parent seek that psychological evaluation and cognitive testing?
I would say before third grade. I think once you get to the third grade mark, your K through 2 is really teaching you how to do school, how to learn your building blocks. And there's a lot of social stuff in there. There's a lot of building blocks. Once you're getting into your third grade, you're doing a lot of application. And I think that's where we can see people either getting bored and not doing well or in over their head and not doing well. So I would say before third grade would be where I would think if your kid, is hitting their milestones a little later, maybe more second grade. If they're hitting their milestones early, maybe a little earlier.
Excellent. Well, you were just amazing today, Wendy. Thank you so much for your time. Thank you for staying over a bit with us as well. As we close, I just want to leave everybody with this. Autism is not a problem to solve, it's a journey to understand. Your child is not broken, your family is not failing, you're not failing as a parent. Needing the support doesn't mean that you're not strong. It means you're building a team. And that's really what this playbook seminar is all about, is building a team. This team is going to change. Sometimes you got to take somebody and put them on the bench. And sometimes we're going to pull our licensed clinical social worker with a C off the bench and put them on first base because they are critical for that point in time for your child's development. So it's very important for us to collaborate and bring together medical care, behavioral health, family support, community partnership, which we talked about today. And when all that happens and everybody comes together, it's very powerful. We move from crisis into confidence, from exhaustion into empowerment, and from simply surviving into truly flourishing. The goal for your children is to function at the top of their ability and to help them to do whatever they want to do in this world successfully. So at Amazing Kids, our commitment is to you to reduce the fragmentation that unfortunately comes along with our healthcare system and getting your kids diagnosed properly and getting your kids the proper interventions. We only focus on autism care to provide you integrated, strength-based care to support not just your child's development, but your family's resilience. Resilience, that's a key word that we like to use a lot in the military system, but it's essential for success. And so because autism care is not just about milestones, it's about building those relationships. It's about emotional safety. It's about helping children to grow into who they really are meant to be and helping families feel supported every step of the way. So I want to thank everybody for joining us today. Thank you for trusting Amazing Kids. Thank you for your time. And thank you, Wendy, all the way from Germany. Thank you for joining us in between your world travels over there. We look forward to you coming back to the States and setting up your own practice in 2027. Not easy being a military spouse, not easy being a military family. We thank you all for your service and your time today. And thank you for helping our families to be something stronger together by having you here today.
Thank you for having me.